HIV is a virus that attacks the immune system of the individual, weakening their ability to fight off infections and diseases. It is most commonly spread through sexual contact, sharing drug needles, and from mother to child during childbirth or breastfeeding. When it comes to sharing drug needles and engaging in oral sex, the risk of transmitting HIV increases significantly. When individuals share drug needles, they are at a high risk of transmitting HIV due to the exchange of bodily fluids. Needles that have been used by an HIV-positive individual can contain traces of the virus, which can be introduced into the bloodstream of the next user. This risk is further heightened if individuals engage in high-risk behaviors, such as injecting drugs multiple times a day or sharing needles with multiple partners. Similarly, engaging in oral sex can also increase the risk of acquiring HIV, especially if there are cuts or sores in the mouth of either partner. Although the risk of transmission is lower compared to vaginal or anal sex, it is still important to use protection, such as condoms or dental dams, to reduce the risk of exposure to the virus. Additionally, the presence of other sexually transmitted infections can also increase the risk of HIV transmission through oral sex. Furthermore, combining the risk factors of sharing drug needles and engaging in oral sex can further elevate the risk of contracting HIV. For example, individuals who inject drugs and engage in unprotected oral sex with multiple partners are at a higher risk of HIV transmission due to the increased likelihood of coming into contact with the virus. In addition, the stigma surrounding HIV can also play a role in the spread of the virus among individuals who engage in risky behaviors such as sharing drug needles and engaging in oral sex. Fear of judgment or discrimination can prevent individuals from seeking testing and treatment, which can lead to further spread of the virus within their community. Education and awareness are crucial in preventing the spread of HIV among individuals who share drug needles and engage in oral sex. By providing information on the risks associated with these behaviors and promoting safer practices, such as using clean needles and practicing safer sex, we can reduce the incidence of HIV transmission. Furthermore, access to testing and treatment is essential in managing the spread of HIV among individuals who engage in risky behaviors. Regular testing can help detect the virus early and allow individuals to access treatment options to manage their condition and prevent further transmission of the virus. Supportive services, such as counseling and harm reduction programs, can also play a role in reducing the risk of HIV transmission among individuals who share drug needles and engage in oral sex. By providing resources and support to individuals at risk, we can empower them to make safer choices and protect themselves and their partners from HIV. In conclusion, the intersection of sharing drug needles and engaging in oral sex can increase the risk of HIV transmission among individuals. By understanding the risks associated with these behaviors and promoting safer practices, we can work towards reducing the incidence of HIV and supporting those who are affected by the virus. Education, access to testing and treatment, and supportive services are essential in preventing the spread of HIV and promoting health and well-being within our communities. 10 Down WJ, where creativity meets impact. 10 Down WJ, ENT